My friend Glenn Simpson, who is the service line administrator for behavioral health at ECU Health. And it's always good to talk about mental health. Glenn, how are you?
I'm doing well.
Nice to see you.
Thank you for having me.
When you talk about mental health, a lot of times we hear the term mental illness, but talk about the difference between mental health and mental illness.
So when we're talking about physical health, we say somebody's in good health or bad health.
Yeah.
Mental health is health, and it's kind of the same thing. So somebody could be mentally healthy, somebody may be mentally a little unhealthy, but there really are things, illnesses, diseases of mental illness. So somebody who, like myself today, I may be feeling a little anxious being on the air with you, Henry, but when I leave here, I will feel good.
Yeah.
And so maybe my mental health at the moment isn't what it really needs to be because I'm a little anxious, but that does not mean I have an anxiety disorder. So the difference really is on the spectrum. So mental health is, we all have mental health, right? Some of us have good mental health, some of us have bad mental health. And like other health conditions, it ebbs and flows depending on the situation, our treatment, our care, our life circumstances.
I'm old enough to remember when you didn't talk about mental health, you know, people just didn't talk about that. Your mom would say, that's not something we want to talk about,
Right.
you know. But people talk about it today, and it's healthy, right?
It is healthy to talk about it, and we've seen more talk about it since the pandemic. Because what happened during the pandemic is we all got a little stressed.
Yeah.
A lot of people had increased anxiety and depression. We were isolated. And so what that did is kind of help normalize it. Because before, as you said, you wouldn't talk about it because it was only a few people. So
Right.
people didn't want to talk about it. While today, many people have mental health and we have a greater understanding of it. In fact, 1 in 5 Americans will suffer a diagnosable mental illness this year. So it is very prevalent. And we want people to be educated, know about it, and get the treatment if they need it.
Wow, 20%.
20%.
So, what are the signs? I mean, if you're getting sick, you have symptoms, and you're like, oh, I better go have that checked out with a doctor. But you know, what are the signs from mental illness that you may need help?
So what we probably need to do is look at some changes. So, you know, somebody can have a heart condition and not even be aware of it. Right? It may be asymptomatic. They may not know it until they have a heart attack. But with mental health, the easiest thing to do is look at changes. So somebody who may be used to sleeping very well all the time starts having trouble sleeping. It could just be that they ate something that didn't agree with them, or that could be a sign.
Or caffeine.
Or caffeine, right.
As in my case.
But that could be a sign.
Yeah.
Or somebody who, as a college student, who goes through, doesn't have any trouble with exams, and all of a sudden starts really worrying about an exam. Is that anxiety? Maybe, maybe not. So really looking at changes in mood, behaviors, and habits, and then the person recognizing that, or maybe the loved one of the person saying, hey, you know, you seem a little bit different, what's going on? And it's okay to ask. In fact, we need to ask, and it's okay to talk about.
So, if you do start feeling these symptoms, or you got a family member, your spouse or a child or parent, anyone that you're seeing develop some of these behaviors and symptoms, walk us through the best course of action.
Well, the first step is for the person to reach out or somebody reach out to them. Again, if you see a friend that seems to be acting a little differently than what they used to, ask those questions. Not only say to your kids, you know, what did you learn today, but how did you feel today? And if somebody says, I'm not feeling so good about my emotions or whatever it is, there's lots of help out there. That could be in talking with the family. It could be talking with clergy. It could be talking with the school guidance counselor, your doctor. If from a medical standpoint, you could go see a counselor. And if you're not so sure what to do and you're feeling like you're having a little bit of a behavioral health crisis, 3 numbers, 988, 24/7. National helpline
Oh,
for
wow.
folks
I didn't
with
realize
behavioral
that.
health.
988.
988. And the really cool thing, Henry, is 988 in North Carolina is answered here at an organization in Greenville, North Carolina.
No kidding. That's interesting.
Yeah. So, and they're there. They have trained counselors, can walk you through. It's not just for people that may be suicidal or something really severe, and they have resources available. But again, just reach out to somebody and let them know what's going on.
Again, Glenn Simpson's with us. Glenn is a service line administrator for behavioral health at ECU Health. And the most important 3 numbers to remember, 988. I have to remember that. So when you call 988, it's like calling 911 for an emergency. If you've got a mental health emergency, that's a good number to call.
That's an excellent number if you have a mental health emergency, or if you have a mental health question or issue.
Yeah.
It's just not
Yeah.
for emergencies.
Gotcha. Anything else that I didn't ask you want to mention?
Well, again, just that, mental health is health, and we need to take care of our mental health as we need to take care of our physical health.
All right, great. Good to see you. Thank you, man.
Yeah, thank you.
Absolutely.
Okay,
Great to see you again. Glenn Simpson from ECU Behavioral Health, the service line administrator here in Greenville.